Welcome to the What Now podcast, a podcast for people who are struggling through the 5 stages of grief. Nurse Melinda is here to show you how to embrace it and cultivate it into something beautiful. And now to assist you in the journey of life's shit show, Nurse Melinda.
Well, hello, Nurse Melinda.
Hello, Michael.
How are you today?
Great. How are you?
Great. I see you brought a friend along from what I understand. This is Rafael Capitan, who is the center director for the Brain Health Center that provides TMS therapy to mental health, people who need mental health treatment. And I guess people come from all over the world to their center right here in St. George just to see Rafael and get some treatment. So welcome today, Rafael.
Yeah, thanks for having me. I'm excited to be here.
So Melinda, why don't you tell us a little bit more about Rafael and TMS?
Yeah, so I wanted to kind of give another outlook on why we're doing the podcast. So Rafael is familiar with the podcast, considering we just started. I did this, Rafael, so that we could have an idea of what suicide really is. And, you know, with the whole premise of preventing it, of course, but what happens if you've attempted and haven't succeeded? Are there glory stories after? What happens to the families who have had family members succeed? And how have they coped and where have they went forward? But the biggest thing, especially with you being here with us today, is how do we help people realize that it's just a moment in time, and how can we help them with alternative areas of treatment? One of the things people say is, I don't want to go get treatment because I don't want to be labeled. But my thing is, the people that work in the industry either have had suicidal ideation or have had members who have, and this is their way of giving back. This is their way of letting people know they're not alone. So when you go to seek treatment, you're not going to somebody who isn't familiar with it. And so that's why I asked you, for many other reasons, but to be a guest on our show, because I know that that's near and dear to your heart.
Yeah, thank you. Yeah, it's a dark place to be in. I've been there. I attempted in 2008, was upset afterwards that I didn't succeed, because that's just where I was in my mindset. Juggled medications for 3 years, and I just couldn't deal with the side effects, so I just dealt with my depression for about 15 more years. And then the summer of COVID came in, and I was in that dark space again, and that's when I found TMS, and that's what we do at the Brain Health Center. And I looked into it, and it changed everything for me. And so it's been a big deal in my life and in my family's life. It's interesting. Mental health doesn't just affect the patient. It affects the people around them as well. And it's not just them.
Rafael, can you tell us a little bit more about TMS? I understand that stands for transcranial magnetic stimulation. Did I
Correct.
get that right?
Perfect.
Wow.
Yes.
Sign me up.
There you go.
Tell us a little bit more about that, what it is and how it works, and what are the benefits?
Yeah, thank you. So it's transcranial magnetic stimulation. It's magnetic pulses that the brain will convert into energy. And the brain will use that stored energy long term to reconnect neurons and create new neural pathways. Oh. So in essence, TMS energizes the brain to help it function more like it's meant to. I mean, it's been around since the 80s for depression. The last 10 years, they've used it for more conditions like anxiety, OCD, ADHD, PTSD, insomnia, addictions. Right now, they're doing a lot of promising research for Parkinson's disease, dementia, Alzheimer's, even amnesia. So if the brain's energized and it's working better, people get real relief from the treatments.
So it actually has the ability to create new neural pathways?
Correct, it can. And so that's how it works. What we love about it is the body can't reject the magnetic pulses. The brain has to convert those into energy, where a lot of people struggle with medications because sometimes the body can reject certain medications, and that's why a lot of people run into side effects. And some side effects are sometimes worse as far as causing worse suicidal ideation thoughts and things like that.
Wow.
Well, what I noticed too with medications, it's also a compliance issue too. If you're getting on a medication, some of them take almost 2 weeks to a month to even start working. So, 2 weeks in, you're like, this isn't even working. Or you get into a month or two of it, and then you're like, I feel great. I don't need this anymore. Instead of people just realizing that sometimes the medications are actually saving your life, but because of the stigma, they don't want to be on them. They don't want people to know they have the medicine. They don't want people to see them taking the medicine. It's kind of sad that we are sacrificing our own mental health, our own physical ability because of some imaginary fear that really isn't there. And that's why it's so important to talk about it.
So it's almost like there's a negative sociological stigma that's attached to it. Oh, if you're doing something to enhance your mental health, or maybe you've got something you think is wrong with you, nobody wants to be my friend anymore.
Yeah, but we'll go to the gym and enhance our body all day long, right?
Yeah.
But what are we going to do about enhancing our mental health for sure?
Right. You're right. That's sad.
Yeah, I mean, I hit it really well. I put on the happy face for people, but when I attempted, my wife had no idea I was struggling. And so I think a lot of people experience that when they're in that dark space. They feel like they can't talk about it, or they can't share what's really going on and what their thought process is because of, possible stigmas, or, back then it was still one of those things where, oh, you're just being selfish because, you want to end your life. And I think it's getting a little bit better right now, just because we've seen the increase, unfortunately, with suicides, especially in our youth. I hope that it will continue to get better, where people just feel comfortable seeking help and opening up about how they feel, because it's really hard to keep it all to yourself.
So do you think the cause could it be like emotional stress, overcoming a traumatic experience in their childhood or sometime in their life? Or are there chemicals in the food that we're eating that can be exacerbating that type of thoughts that people would have to commit suicide or take their own life?
I would say there's endless reasons of why somebody gets in that space. It could be from PTSD, from a childhood trauma. It could be situational, something that just happened and they just feel like they're done. What I realized going to the hospital for 3 days after I attempted was everything I was telling myself wasn't true. My wife would be better off if I wasn't here. My kids would be better off with a better dad. Everybody would be happier if I wasn't here. That really wasn't true, but that's what I felt. That's what I was thinking. And so, but there could be so many reasons why somebody experiences suicidal ideation. And that's what we see with our patients that come into our center, looking at TMS as another option. They're all struggling in different ways, but they're all struggling. And so it's just, everybody's different. Age, history, their health. And so I think there's just an endless amount of reasons why somebody could be in suicidal space or having suicidal ideation.
So tell me how that TMS therapy works. I understand that unlike other treatment centers around the United States, people come here to St. George from all over the world because yours, what you can accomplish in 5 days, what other facilities takes a couple of months to do. Is that true and correct?
Well, and it's crazy. It's 5 days. Like if you're suicidal or feeling suicidal, you literally could check in and 5 days later check out. And how long does it last? Does the therapy have to have a reboot?
Yeah, that's a good question. So we are one of a few clinics in the country that do the new 5-day TMS treatment. It was approved by the FDA 2 years ago. It's also known as the SAINT protocol, is the medical term for it. But the research found that the results are better and they last longer from the 5-day treatment compared to the standard TMS treatment, where they have to go in every day for 6 to 8 weeks to complete 36 treatments.
Wow.
The 5-day treatment, it's 10 TMS treatments a day for 5 days. So they're getting 50 treatments in 5 days. And there's only a few places in the country that do it. We have a beautiful brand new facility, the latest TMS technology to do the treatments, an amazing staff, and nobody can come close to the TMS rates that we have. We have the lowest rates in the country. And so that's why a lot of people do come here from out of state. Or last year we had somebody from Hong Kong come and do the 5-day treatment with us. In May, somebody from Australia is coming to do the 5-day treatment with us here in St. George. And so most of our patients that complete the 5-day treatment come from out of state. But to answer your question, Melinda, it's meant to be a long-term solution. The hope is that people don't need TMS again. But everybody's different. So some people might want or need maintenance treatments down the road. But what the research found was for depression, the 5-day treatments can bring 84% remission from depression. So that's really, really good. That's why it's such a big deal. And that's why I believe some places charge astronomical rates because they know it could be a one and done thing.
Did you go through that treatment yourself?
I did 4.5 years ago. I did the standard treatment because that's all there was back then. So I went in every day for 36 treatments. It takes about almost 2 months, but it made a huge difference for me. I know everybody's different, but for me personally, I haven't had a depression episode since my treatment 4.5 years ago. I still get sad. You know, TMS doesn't take away life challenges. It doesn't take away stressful situations, but it can help people to enjoy aspects of life while they deal with life because life's always going to happen. But it's just a really good option for people that have tried everything else.
Wow.
Well, and I think that that's where the misconception is too, is depression is not just sadness. Like, it's okay to cry at a funeral. It's okay to cry if your baby falls down and is crying. It's okay to have moments like that. What I found is depression can go clear down into, I broke a plate today. I'm going to commit suicide because I'm not worthy of even being on here just because I broke a plate. It sometimes can hit so hard that that's really all you think about. And so when we talk about depression, I think it gets this negative lifelong dealing thing, but sometimes it's just moments of not being able to cope. And when you're in that moment of not being able to cope, the only thing you think is, I can't cope. I just want out. I'm done. And that's what I'm saying. It's moments of time. So if you could take 90 seconds after you say that to yourself, just 90 seconds of self-check and self-breathe and know that you're safe, you're alive, you're loved. Sometimes you can move on, but there are times when those 90 seconds have to happen more often, day in, day out, to where you really just can't cope with it.
So what you're saying then is with depression, you could be just living your life, just going along, everything is fine, and all of a sudden an accident happens, like you break a plate, and all of a sudden it triggers that depression, and it's like, I'm not worthy anymore. I can't, I'm done.
Yeah.
And it could be something that simple. It's just almost like you flick a switch.
Yeah, situational. Yeah.
Really.
And people go down the rabbit hole really fast. I mean, I remember when I dealt with my depression, I would shut down for weeks. You know, just lay on the couch, didn't want to get out of bed, didn't want to go to work. I would undereat or overeat. It was a complete shutdown process. And it would take weeks for me to kind of just get back to normal life and everything. And I dealt with that for 15 years. And so it's not fun. It's hard. Again, you have to survive. You have to go to work. You have to be a dad. You have to be a husband. And it's just not easy when you're in that space. And so TMS is a good option for a lot of people because, again, it energizes the brain to help it work better. And we don't have to worry about traditional side effects like we do with medications. It's non-invasive. They don't ingest anything. It's not electroshock therapy. And we can treat ages 8 and up. And so it's been a good option for a lot of people.
So as we were talking earlier, you explained to me, so it's basically you put something on their head and it's 10-minute treatment and then a 15-minute break. And then you
50.
go 50. Okay, I'm glad I clarified that.
Yeah, so the 5-day treatment, thank you. It's 10 TMS treatments a day for 5 days. So it's a 10-minute treatment every hour for 10 hours, and then they have a 50-minute break. From what we know, we're the only place that gives our patients a 5-day private suite for the 5 days in the office, so they have a place to rest in between their treatments. The suites have TV, internet, snacks, drinks. They'll let us know what they want for lunch. We have it delivered. All of that is complimentary. They're just paying for the 50 treatments.
Wow, that's good.
So yeah, it's been a good experience.
So I have a question. I mean, in our medical clinic, we offer ketamine, and the reason we offer ketamine we offer ketamine to those who are actually trying to seek help, where their provider has requested that patient do it. We don't just offer it for people off the street. But in ketamine, you have to wait so many days, and you have to give yourself positive feedback in those days. Like, you don't want to go home and watch a murder show or documentary that has to do with, I stalked so many people, because it's trying to rewire in those days. Does that make sense? But how does that work? Because you have the TMS, but you have the TV. Is there, I guess, a limit to what you should be putting in your brain right after the treatments?
Well, good question. So that's why I was saying before, the brain can't reject the magnetic pulses. It has to use those magnetic pulses into energy. And so, yes, we want to make sure that they have a good environment. I mean, most of our traveling patients, they have somebody come with them, and they're there in the office with them, supporting them. And I don't think we've really ran into that situation where somebody is in our facility and they're not having a good positive experience. Of course, we monitor what they watch during their treatments in the treatment rooms. They can watch whatever they want to watch in the suites, but I don't think we've really ran into that concern as far as what they're watching or putting in their body. I mean, of course, we recommend that they don't, use drugs while they're here or anything like that. But that's a good question, because I've never even thought about what could they be watching in their private suites and stuff like that, because I don't think we've ever really ran into somebody having kind of a negative experience while they're in the facility.
Well, and I think that's part of it is, after ketamine treatment, they go home. They're going home to the environment that may be causing the stressful situations that they're trying to deal with. And so I love the idea that they can stay at the facility for the 5 days during their treatment, because then it's more of a guided thing. Does that make sense?
Yeah, and most of our patients, because they are traveling, they are away from home, so they're in our office for 10 hours, then they go to where they're staying overnight, and then they come back the next morning. But it's in St. George. It's beautiful. There's mountains, the air. We had somebody from Maryland in January, and he was like, "Your streets are clean. There's no traffic." Like, he was just amazed. He's like, "I want to move here." And we've had a lot of patients say, "I want to work here." Like, it's just a beautiful place to have a center. Like, we have close to Vegas. A lot of people would fly to Vegas and drive here, but we have our airport here. But yeah, I think being in St. George makes a big difference for our patients that are here for a week. And then, of course, we have our local patients that are here that can do the 2-month treatment, because they can come in once a day. Or we have our free treatment for suicidal ideation as well.
So, Rafael, I have a question. So I have a family member who, through certain circumstances in his life, basically became, in order for him to deal with his depression, he became an alcoholic, he became addicted to drugs, and then went through the whole thing. And would the TMS treatment, would it also facilitate some relief from those types of things as well? Maybe he only wanted to kill himself because he was addicted to drugs and alcohol, or is it like I hate to use the word, a twofer? Can you get a twofer out of this? Help my anxiety, my depression, my desire to want to do away with myself, and oh, by the way, I really don't want to drink and take drugs anymore. Can it have that type of effect as well?
Great question. So thankfully, the brain is all connected. So we have had a lot of patients that do just the depression treatment the whole week, and they get benefit from anxiety or some other challenges that they're having. However, TMS treats other things like addictions, anxiety, OCD, ADHD, PTSD, and there's different site locations on the scalp for certain conditions. And so I don't know if many places do it. We've had a lot of success with our patient results from customizing the 5-day treatment for our patients. In other words, if they choose, after meeting with our provider and he does a full psychiatric evaluation with them, and if they feel like they want to tackle 2 to 3 different conditions while they're here with us for 5 days, then he'll help set them up for their treatment for depression and anxiety, or maybe depression, OCD, and addictions. Everybody's different, and very rarely does somebody come in and all they're dealing with is depression. Most of them are dealing with multiple things. And so our patients have really enjoyed being able to treat 2 to 3 different conditions while they're here. And we've had a lot of success with the results that we've had, and that's why we've continued to do that. Just we want to make sure that we're not just giving everybody a cookie cutter treatment, that everybody gets the same thing, because nobody's going through the same thing.
So the treatments are personalized depending upon
what they're going through.
What you're going through, your specific needs. I think that's incredible. I know Melinda, you've probably seen a lot of positive benefits from this type of treatment too.
Do you know what? I think that anything that you're doing to help promote yourself, right? You're working on yourself. You're working on being a better person, and having the tools and knowing about the tools and the availability of the tools is hugely important. I don't think that there are very many people, they may have heard TMS or seen commercials, but they really don't understand what it is. And so that's kind of my goal here, is to just allow people the opportunity to see there are choices, and there are people who, like Rafael, who have been there, like literally been there, and has found a way out and a way to make other people's lives better. And that's huge.
That is huge. That's amazing. So, Rafael, if somebody has any questions about the TMS treatment, how's a good way they can get a hold of you?
Best way is to go to our website, brainhc.com, and they can message us on our website. I call within 24 hours. They can call us directly and answer all their questions. There's no pressure to get treatment. If they're local, they can come in and get a free psychiatric evaluation with our provider. He's licensed to diagnose, prescribe, and treat. So somebody doesn't have to have a pre-diagnosis, and they don't have to have a referral to come and get treatment with us. So we do it all there. We have a full-time provider, which is rare for TMS clinics, so we're excited about that. But brainhc.com, they can take a virtual tour of our new facility. They can meet our team. Most of our reviews are from our 5-day patients, so they can see what our patients experience when they come here. But it's just, it's so rewarding being at the Brain Health Center, because we get to see people light up again and get real relief.
Yeah.
And just on the topic of today's show, I just want to make sure that people know that we do offer a free 3-day treatment for suicidal ideation. It's 3 treatments a day for 3 days. It's completely free if they're experiencing suicidal thoughts. They'll come in, have the evaluation. If our provider feels that they're safe enough to do a 3-day treatment, it's completely free. So we just want to make sure people know about that. Nobody we know does free TMS, and so we hope that's a way to give back.
That's incredible. I'm glad that we just showed your website up there so everybody can see. If they have questions, they can reach out to you. Melinda, any?
Yeah, I have a couple of questions, really. So if you're dealing with something like this and you know you need help, but you're afraid that the information is going to get back to social services because maybe you're in a custody dispute, or to your job, or to even your spouse, honestly, is there a protection for that? Or is that like public knowledge? How does that work?
Yeah, so we follow HIPAA regulations. So if somebody's 18 and over, then we don't share any information with anybody. The only patients that we have that we deal with parents is our 8 to 17-year-old patients. And so, but yeah, we have to follow the HIPAA regulations. So we don't, like, if somebody didn't want us talking to a spouse, then we can't. So.
And honestly, I think that it shows bigger of, I see you have depression, I see you've done something about it, and we're working on it, versus you have depression, but you haven't done anything about it. So you know what I'm saying?
Yeah.
Like if you're worried about that component of it, the idea that you're getting treatment and getting help is way better than you just living in a life of torture.
Yeah, reaching out to us is one of the biggest steps, because, again, they're going through that time, and the thoughts are not headed in the right direction. And so, again, if somebody is safe enough to come in and they don't need to go to the hospital, to the access center, then we would love to help them. And so,
great.
But yeah, the biggest step is just reaching out and seeing, what options are out there.
So one more question. Considering your history of attempt and not succeeding, which is the number one reason why I never attempted, was because I knew if I didn't succeed, life could be way worse. I mean, you're lucky that it wasn't, so medically traumatic. But if somebody's in that spot right now, knowing where you've been, and if you could go back to that spot where you were to help somebody, what would you say to them?
Talk to somebody. that was my biggest thing, is I felt like I couldn't talk to anybody. I was afraid to talk to my wife. I was afraid to talk to my mom, my in-laws. I actually told my father-in-law before I even told my wife that I had attempted. And so talk to somebody, just 5, 4, 3, 2, 1, and talk to somebody that first comes to your mind, whether it's by text or call the number. I believe it's 411, or there's a free number for people that are struggling with suicidal ideation. Somebody that's close to you, even somebody that maybe you're not close to, just say something to somebody, and I think that will kind of get the ball rolling in the right direction to get help. But if you don't tell anybody, it's really hard to just deal with all of it on your own.
Well, and coming from somebody, if somebody talks to you about it, there are resources. There is help. It's not that person you're talking to. It's not their sole responsibility to be the savior as well. Their responsibility is to listen, love, accept, and embrace, and then find help.
Right. Yep, absolutely.
Sounds good. Melinda, any last parting words before we go? And how can people get a hold of you if they have more questions?
Well, we're always on the web at www.finishfirstmedical.com. That is our clinic. Otherwise, you can find me on YouTube or on Facebook or
just call
in the world at the grocery store.
At the grocery store, I think. Well, I want to thank you guys for being here, Rafael. It's been wonderful to have you here. Lots of good advice. Melinda, Nurse Melinda, as always, a complete joy and a delight.
Thank you, Michael.
We'll see you guys again next time with another What Now podcast with Nurse Melinda.
Thanks, Rafael.
This has been the What Now podcast with Nurse Melinda. Please like, subscribe, and share. We invite you to join us next time as Nurse Melinda assists you through life's dramatic shit show on the What Now podcast.